Hey everyone, how you doing? My name's Gus. I'm a cosmetic and implant dentist based near London in the UK, and today let's talk about all-on-4 treatment and specifically, does it hurt, what to expect after having the treatment. So usually when my patients come in and see me, 99.99% of my patients, especially on the day, are somewhere between anxious and terrified. Okay, nobody is calm at the beginning of this appointment, and a lot of it is due to the perception that it's going to be extremely painful. Now, all-on-4 is probably one of the more extreme treatments which we carry out, and therefore you would think that if you have found a filling painful in the past, this is going to be a million times worse. Now, it's not actually like that, and in this video I'm going to show you a couple of different ways that that we control the pain during treatment. I'll give you an honest perception from all the patients who I see. Is it painful during the treatment? Okay, and if I was going to say it's not painful, I would be lying. And what to expect afterwards, okay, during normal healing and some of the complications which I've had. In fact, I had one literally this week. So let's go straight into this. For those of you who don't know, all-on-4 is a treatment where we are able to remove all of the bad teeth, typically they're infected in some way, and place dental implants so that our patients can have a fixed set of teeth on implants, and it's all carried out in one main surgical appointment. Okay, so that's the key selling point of this treatment. Now, there's two aspects to it. There's the surgical side, and then there's what we call the prosthetic side. The surgical side is what I describe as the first cut to the last stitch. Okay, so we do all the anesthetics. This is the stuff which would be painful if you weren't anesthetized, and then the stitch is when it's all finished. So typically this takes between 1 and 2 hours in the vast majority of cases. And after that, when we move on to what we call the prosthetic side, connecting the teeth to the implants, this can take 1 to 2 hours as well. So we normally book either a whole morning or a whole afternoon for an all-on-4 treatment. And that's kind of how it's split up. Half of it is surgical and half of it is prosthetics. And for the vast majority of our patients, we do this under what we call local anesthetics. So the same anesthetics which your dentist has been using to do your fillings, that's what we use for this full arch treatment. And for the vast majority of cases, it works absolutely fine. Obviously, we give a lot more anesthetic than you would have if you were just going in for a standard filling. The types of injections which we give in certain areas are slightly different, but it's just a specialized way of doing a normal dental anesthetic for this more complicated treatment. Now, the things to know about anesthetic are, they take about 10 to 15 minutes to really work. So we always do all of our anesthetics, get all the injections done as early as possible. And then my nurses and I, we set the room up. So we do a full, what we call an aseptic setup with all the green sterile drapes everywhere. And that process takes us about 10-15 minutes. By the time we finish that, we're actually ready to start our treatment. And I think a common mistake that especially younger dentists do is they just start too early. The anesthetic hasn't really taken full effect. It hasn't had the time to do it, so things hurt. So we always give it a bit of time, let it work. Next, there is a window of about 2 hours where the anesthetics work really well. So we do need to speed things up. We do keep things brisk. Once we start going, we don't want to slow down, because as soon as my patients start to feel something, I know it's difficult to maintain that really high level of anesthetics. Okay, so when I said some patients do find this uncomfortable, at the beginning, almost absolutely everyone is fine, but there comes a point where sometimes people can start to feel stuff. And this is where individual interpretation of pain comes in quite a lot. So you see, when anyone is subject to a painful stimulus, some people will react more, they will feel the pain more than other people. Okay, and this is just a normal variation, we're all different. And those people who are unfortunate enough to, experience more pain are going to find this a much more difficult scenario to deal with. And a couple of weeks ago, I did have a gentleman who was like this. We did the all-on-4, everything was going really well, but the last 20 minutes he found very uncomfortable, and we really had no choice. We just had to battle through it. And I don't like it. It's difficult for me. The patient doesn't like it. It's painful. And for this reason, I'm actually starting to do more sedation, or I would recommend sedation more for other patients. So I'll talk more about what sedation is in a minute. Let's very quickly talk about perception of pain. You see, when we're exposed to a stimulus, whatever it is, it doesn't really matter. And I don't mean to keep throwing scientific terms, but if we have something painful done to us, people react differently. And this is related to their perception of pain and how nervous they are. So when somebody comes to see us for all-on-4, everybody is somewhere between quite anxious to terrified. Okay, they're in that kind of ballpark. Nobody comes in for an all-on-4 on the day of treatment and says, yeah, I'm completely relaxed. Okay, nobody is. So if you're already anxious and you think that things are going to really be painful, then you're probably right. You're telling yourself that story. It's almost like a self-fulfilling prophecy. But what happens is your mind is already telling you that it's going to hurt. So any stimulus that you have, any pressure or mild pain can be interpreted as a lot of pain. And unfortunately, some people don't really have much control over this themselves. Now, we know this is the case, and also, surprisingly, you may not know this, there are some dentists who are really good at hypnosis. I'm not one of these. I really don't know much about the subject, but I've been told that they're able to take out teeth on patients without any anaesthetic. Okay, so I assume this means that they have to have a patient who is responding well to hypnosis, and obviously their skills need to be on point as well. But my reason for telling you this is there is a very large psychological component to the perception of pain, and if you will find all-on-4 painful, which is why these days I'm kind of recommending sedation a little bit more. So sedation is when we have a specialist sedationist who comes in, they give a drug through the back of the hand. The drug is midazolam plus other ones. These guys are specialists. They've got access. These are hospital sedationists usually. So they've got access to a whole cocktail of drugs really. And what it ultimately does, it really relaxes the patient. And it provides a period of amnesia where you can't remember the procedure itself. And if that is done and we combine that with our normal dental anesthetics, then the treatment is actually a lot easier for the patient, and therefore it's easier for the clinician as well. So this is a really cool thing to have. The problem is it does cost more money. Okay, when we do this for our patients, typically it's about £700-800 plus to have this done. Okay, so it's not cheap. It adds cost to an already expensive treatment. The other downside is that you can't drive for 24 hours afterwards, so you need to bring someone with you who is able to basically take care of you for the next 24 hours while the medications just work their way out of your body. Now, there are some situations where even those people who are really good with pain will find things uncomfortable, and that is if there is really active infections in the areas where we're looking to treat. So you see, almost everyone has had a friend tell them a story about this root canal treatment which was really, really painful. Now, the funny thing is root canal treatment itself, it shouldn't actually cause any pain, because the nerve is removed very early on in the process. But the reason that everybody will say that root canal treatments are very painful is that the reason they need root canal treatment is that the nerve is inflamed to begin with. Okay, so you've got this really acute infection, okay, which is what inflammation is, and this inflammation is all around the tooth. Dental anesthetics don't work as well in really inflamed sites. Okay, so you can have ongoing infections and these will numb up quite nicely, but if you've got a really bad toothache, trying to numb that up and remove the nerve is often quite painful, which is why anyone who tells you a story about root canal treatment is painful, that's why. Usually, I haven't done root canal treatment in a long time, but root canal treatment is that treatment where our patients are likely to fall asleep. It's very quiet, it's painless. Okay, so inflammation, active infection in the area is going to make any treatment, including All-on-4, more painful. So, all being said, what can you do about it? What can you do to make this experience less horrible? So number one is consider sedation. Okay, if your budget allows it, I think this is a really good thing to do, especially if you're considering top and bottom. Okay, and you know that you're not good at the dentist. So consider sedation. It's a really good option. Hypnosis or self-hypnosis is a key area where I think I need to learn a bit more. Okay, when my wife was pregnant with our first child, she did all this hypnobirthing and all this kind of stuff, basically to get the mind in a much more relaxed situation. You see, a lot of people, especially when it comes to going to the dentist, is a very emotive place to be, and it brings back all these horrible past experiences and it makes you on edge. What you need to do is, first of all, almost forget about all of those problems and all that historic experiences that you've had, and try and create a new positive association with going to the dentist. And this is what we often do. So I've got point number 3 here, multiple visits. And what that means is get to know your dentist. Go there a few times before having this treatment done. It's important that you feel comfortable there. And for our nervous patients, we do try and see them several times. I mean, I've had patients who there was one lady who I was treating last month, and her problems and all her dental anxieties stemmed from the fact that her uncle passed away in a dental chair. Now, this is the first time I've heard of this, but this is reasonable because a long time ago, dentists used to provide general anesthetics in the dental chair. Now, this is very dangerous and people died, and which is why we don't do this anymore. So getting over that is a matter of building trust. And once you build trust, you will be more open to having these kind of treatments done. Okay, so trust it takes time, and you need to basically destroy that perception of the dentist causing pain and overlay it with, actually, you know what, I'm going to this dental practice, they're really nice there actually, and they do take good care of me. Okay, so find a dental practice which is like that, where they do take time, where you're not rushed in and out of the surgery, because it's not doing your anxiety any good. Now, that's all the treatment, that's what's happening in the room on the day. Okay, what about afterwards? Afterwards, you're probably going to feel tired, even though you haven't actually done anything. In fact, you've pretty much been lying there for 2, 3, 4 hours, whatever it is. You will feel tired. It's mentally draining, and it's not the best place to be, let's face it. Now, you go home, and when the anesthetic starts to wear off, pain usually increases, okay? And this is a general soreness usually, okay? And we give our patients ibuprofen. If they're good with that, we'll give them that, or paracetamol. Any over-the-counter painkillers are really good. You shouldn't really need many of these. Expect swelling and bruising. Okay, these are 2 very common things which you're going to have for a few days afterwards. Some people get black eyes if we do the top arch, and usually the swelling, if it happens, or the bruising, it will kind of just work its way down. Okay, it is a complex procedure, and we're working near certain blood vessels. Bruising is very common. Usually, if it looks bad, it usually looks much worse than it feels. Okay, pain afterwards isn't really something a lot of our patients complain about. Okay, the swelling and the bruising, yes. Pain, not so much. Okay, and also they all tell me that it's a lot easier to deal with pain if you're at home. Now, last week, or I saw for a review last week, maybe 2 or 3 weeks ago, we treated a lady. We did an all-on-4 at the bottom. Treatment went really well. She had it with sedation. She didn't really feel much. My nurse called her up a few days later. Everything was fine, but then pain started again. And then 2 weeks later, we like to see our patients after treatment. And what we saw was that the stitch, which goes all the way from left to right, had come undone in one area. And this is painful. When a stitch comes undone, you start to get a different type of healing. It's not a problem at all, but it does cause pain. Okay, and it's not a very common thing that we see, but I think it happened in this case because the muscles of the chin, so we were doing her lower arch, the muscles of the chin attach very close to where we did our stitches. So if she had just pulled her lip down at all, it would have put a lot of tension on the stitches and basically tore them open. But it happened. I saw her yesterday for another review. It feels perfect now, and clinically it looks really good. So these are things which can happen if you're experiencing pain. If you've had all-on-4 recently and you're experiencing pain now, it's not going to feel right for 2 or 3 weeks. Okay, that's number one. Sometimes the stitches themselves can be painful. So as soon as you have the stitches removed, then it should feel a lot more comfortable. But if you're having all-on-4 treatment done, your dentist is going to want to know if you're experiencing a lot of pain or anything like that. So just give them a call, and they should be able to field your questions and see you for a review. Okay, so I hope you got something out of this video. Okay, I don't want to tell people that this is a completely painless and amazing process. Yes, the end result is fantastic and it is life-changing, but it's not easy for most of my patients. Some of my patients just walk through it and they're absolutely fine, but I'd say about 60 to 70% there's a kind of a road bump in the middle where it's not a nice, pleasant experience. But this is just the way it is at the moment. Okay, so I hope you found it useful, guys. Until next time, take care.